The London Family Health Team, or LFIT for short, is a team of professionals whose mission is to create a medical home that emphasizes maintenance and improvement of the health of our community through preventative care, health promotion, and patient education. Over 21,000 patients are served by an interdisciplinary team of 16 physicians, nurse practitioners, registered dietitians, respiratory therapists, pharmacists, psychologists, registered nurses, and social workers, each with expertise in diverse areas of treatment and care. The Allied Care Team is dedicated to a vision of improving the health of families in our community through patient-centered care. This vision is carried out by their commitment to providing compassionate and respectful care following the best practice guidelines. These guidelines are reflected in LFIT's core values, which include collaboration, honesty, integrity, and empathy, dedication and commitment, patient-centered care, positivity, and education. Values that I share and wish to practice as I work my way toward my career goals. I was able to observe the Allies in action during team meetings and when other professionals were consulting with Dr. Chapman on client cases. I realized how much work goes into an integrative healthcare team. The effort that Allies put in behind the scenes really ensures that patients receive the best care that they can get. My placement experience at LFIT has been nothing less than a journey of both personal and professional growth with the support of my supervisor, Dr. Jonathan Chapman, interpreter Paulette, and of course my professor, Dr. Kathy Chauvin, who has worked together to create a fulfilling and rewarding practicum course. In September, I walked into my first meeting with Dr. Chapman with the hope to maximize this learning opportunity and to gain hands-on experience in the clinical world of psychology. Right off the bat, Dr. Chapman and Paulette had created a welcoming and supportive environment for me, and so had begun our supervisor-student relationship. Throughout the first half of my placement, my responsibilities were to sit in on intake appointments, assessments, and feedback sessions. In those 4 months, I observed Dr. Chapman's clinical skills and how he used them to interact with his clients. Dr. Chapman is a clinical psychologist who has a specialization in ADHD and learning disorders in children and adolescent populations. He assesses children who are referred to him by allied family physicians. He starts off by meeting with parents and clients to discuss their concerns and their expectations of what Dr. Chapman can do for them. The second appointment involves a full day's assessment during which he administers various tests of ADHD and learning disorders. If mood disorders such as anxiety and depression are also a concern, he administers tests for these as well. Finally, during the feedback sessions, Dr. Chapman would report assessment results and the diagnosis to the client and their parents. If the client was diagnosed with ADHD or a learning disorder, he would provide them with resources and referrals to agencies that could help them cope better and facilitate daily tasks such as school. If there was no diagnosis, he would still offer the clients his professional opinion and provide them with advice on how they could cope with the areas of their life that they find difficult. After appointments, my role would be to apply my own knowledge and discuss my opinions and approaches to cases. Dr. Chapman encouraged me to practice thinking like a clinician while he provided me with professional feedback and insight. As the second term rolled around, I had the opportunity to work directly with clients. I administered and scored the VERY developmental test of visual motor integration, the comprehensive test of phonological processing, the Wechsler Individual Achievement Test, and the Children Depression Inventory. These tests were more structured, and I learned a lot about individual symptoms of ADHD and learning disorders. While interpreting them, I realized that there are many other factors clinicians should consider before relying primarily on test scores, such as clients' attention span, fatigue, their mood, and motivation at the time of the assessment. Over the course of the entire school year, there were many lessons and skills I had learned with the help of reflective weekly logs and class discussions. For example, watching Dr. Chapman work with his clients reflected the importance of creating a positive rapport with children and adolescents so that they feel safe and supported during consultations. He always did a great job and ensured that his clients were comfortable. Another lesson I learned was not to judge a book by its cover. During the placement, I was exposed to many different family dynamics and client stories, and I realized the importance of being kind to one another because you can never really know the struggle of others. The least we can do is listen, provide support, and practice empathy. Meeting some of the clients was also very inspiring. These were individuals who were struggling with school or daily activities because of ADHD, a learning disorder, or a mood disorder, but they were taking active steps to gain the support they needed at an early age so that they could overcome these obstacles and achieve their best potential. So the biggest and most important and empowering lesson that stood out to me was that a mental disorder does not define an individual. Overall, this has been a fulfilling experience both personally and professionally. I am very thankful to the team at Elfit and Dr. Chauvaz for giving me the opportunity to experience a clinical psychology placement. I have grown so much in the past 8 months, and I couldn't have done it without this amazing group of individuals who are making the world a better place one step at a time. I look forward to continuing my career path in psychology, and I cannot